Hello, my name is Adrian Richards. I'm a plastic and cosmetic surgeon and I'm the clinical director of Aurora Clinics. So today I'm going to be talking about some of the myths or some of the questions I'm often asked about Botox as a treatment. One of the first ones is what will happen if I stop having treatment, and the answer to this is you will revert back to the state, to your appearance now. So Botox typically works for 3 to 4 months. If you stop having treatment, the muscles will slowly recover back to normal activity. They won't be any more than you had previously. Studies have shown that, but often people sort of slightly forget how their muscles were before the Botox treatment and can feel that they've come back a bit stronger, but that normally isn't the case. And that's one of the reasons we like to take photographs of you before treatment, just to, so that we can show you that. So I'd like to dispel that myth that, if you stop having treatment, anything will be worse, because it won't. One of the other things I often hear about Botox is that it makes my other lines worse. One of the problems with Botox is it is almost too effective. So in the area it works, in the 3 main areas, between the eyebrows, across the forehead and crow's feet area, it works very effectively, but it doesn't work so well for the lower face, and in particular it doesn't work for lines which are down here, which are actually caused by smile muscles, by smiling, these lower lines. So obviously you can't be very reluctant or don't want to reduce your ability to smile and move your mouth, so we can't reduce these lines, okay? And likewise, any lines on the lower eyelids which are caused by gravity changes, excess skin, won't be improved by Botox, because Botox weakens the muscle, so it will only help the lines which are caused by muscle activity. So if you have an over Botox treatment to these areas, you can look too smooth in these areas and they won't match your lower face. So you might have a forehead which looks completely line free, but that won't match if you've got slight lines on your lower eyes and your lower cheeks. So Botox doesn't make the other lines worse, but it can make them stand out more in that you look slightly unbalanced. So that's what's important, to really have a holistic treatment. So Botox is good for reducing overactive lines, but we want you to remain natural looking. We don't want you to look unbalanced. And so what we tend to do with faces when we see them, we analyse them in quadrants, and often it might be the lower. In most people, it's rare that the upper face completely matches the lower face. The problem, the ageing problem, may be more in the lower face, caused by volume loss, and that's perhaps what we should address first. In other people, the ageing changes are predominantly in the upper face, and that's perhaps what we should address first. So really, it's about looking at your face, discussing it with you, working out which areas, perhaps the areas which we need to treat first, to try and create a harmonious appearance, rather than create something that doesn't look natural. So I hope that's been helpful. If you have any queries about Botox or any other treatments offered by Aurora Clinics, please don't hesitate to call us, either by ringing us in the office on 01844214362, or alternatively by inquiring via the website. Thank you very much.